Hi, so this is part 2 of my cancer treatment videos. So the first one I spoke about my chemo and then my surgery and then my radiotherapy, I think I did. So I'm just going to kind of touch base on the other treatments that I had and still having. So one of my other treatments is to have Zoladex, and I'll be having that for 5 years, so I've got another 4 years to go. So what Zoladex is, it's basically an implant that they put into your stomach every 4 weeks. I've got notes here because chemo brain is a real thing, okay, so I'm reading my little notes. So basically it treats cancer patients, puts you in a false menopause, shuts down your ovaries and basically stops you from producing estrogen, because my cancer was an estrogen-led cancer. So obviously it was feeding off of that. So I need to stop producing estrogen in order for the cancer to stop growing. So I've got that for another 4 years. So my ovaries are shut down. I am going through the menopause. I'm actually okay with going through the menopause, to be honest with you. I feel a lot better than I actually thought I was going to, but here is a list of the side effects that you can get with Zoladex. So hot flushes, headaches, dizziness, sweating, mood changes, vaginal dryness, increased or decreased interest in sex, breast swelling and tenderness, bone pain, nausea, vomiting, diarrhea, constipation and insomnia. Yeah, there is a lot of things involved in it, but again, I would rather have the Zoladex every 4 weeks and go through these side effects than worrying about the cancer being fed by the estrogen. But one thing I would say with the Zoladex, it is a implant. So the needle is very thick. So I use Emla cream. So basically it's numbing cream. I'm not great with needles, so I always use numbing cream and it's great with that. So if you're not too good with needle pain, strongly suggest getting some Emla cream, which you can get from any pharmacy, Boots, anything like that really. My other treatment I was on was Herceptin. Now, before my treatment started, they did ask me if I wanted to have a PICC line. A PICC line is basically where you have like it's like a operation in itself really, and they do actually put a line that goes straight in through your veins. So then they administrate all the drugs via that, so then you don't have to keep having an IV every time. Because with all the needles that you do have and all the drugs that you do have, your veins can collapse. I decided not to, the option was always there. If I did want it while I was going through my treatment, I could have had it. But I didn't, so we did try to put the IV and everything in my hands, but my veins just used to pop. So we used to pop, I had all my treatment through my arm in the end. And luckily for me, I was fine. My veins were actually fine. But the Herceptin, because I didn't have the PICC line put in, it's an injection on the thigh. Now, Herceptin is an amazing drug, especially when you're HER2 positive and it's an estrogen-led cancer, because that is what basically stops the cancer cells in its tracks. So I've just put here, it attaches itself to the cancer cells and blocking them from growing, and it either slows or stops the growth of cancer. So if you are an estrogen-led cancer, Herceptin is what is going to get you through this and what attacks solely cancer cells, whereas chemo attacks every single cell, good and bad. That's why you feel so ill on it. But Herceptin solely does the cancer. Now, the injections themselves are painful and they take 5 minutes to actually administrate. So they'll pop it in your thigh, really thin needle. But as I say, they slowly inject it in, and it's only a small piece that goes in, but it burns. And I'm not going to lie, I'm very honest about this, it burns, and it basically felt like someone had a lighter to my leg the whole 5 minutes. And I was left with really bad marks. So every single time I had severe bad marks. All the pictures are on my Instagram, which is Claire versus Cancer, if you wanted to see it. But they do fade, those marks do fade, and I've got no marks left on my leg now, but at the time they look awful and it does hurt. But once the injection's finished, it's fine. The pain's gone. So it's just for those 5 minutes. If you can just stand that pain, then yeah. But if you have a PICC line, they'll pop it through the PICC line, so then you actually won't feel that anyway. So the side effects of Herceptin, I had 18 rounds of them, and that was every 4 weeks, is heart issues, joint pain, high blood pressure, back pain, hot flushes, headaches, diarrhea. Now, when you're on Herceptin, it can affect your heart. So you have to have an echo scan every 3 months just to make sure the function of the heart is okay. Each time I had an echo scan, my function of my heart was deteriorating, but not to the point where they had to stop the treatment. So I was extremely grateful for that. And it should kind of correct itself as you're going, as you come off the Herceptin. And the breathlessness as well because of the heart, so you can feel what it's actually doing to you. But again, luckily for me, I didn't have a lot of issues with that. So, but the joint pain and the high blood pressure, I had high blood pressure anyway. I'm already on 2 tablets a day for high blood pressure before I even knew I had cancer. So I had that anyway. But the joint pain is, yeah, that's rough, because I actually was walking around with a fracture on my foot for 4 weeks, in a lot of pain. Basically, the bones in my feet keep cracking, and it is due to the medication that I'm on, and you can actually end up with osteoporosis because of these treatments. So you need to any kind of pain you get like that, you need to go and see your oncologist and things, and then they can do a density scan. But a lot of these treatments will give you other health issues, so you need to kind of keep on top of them and keep going back to the oncologist and finding out what you can do to help those. My next treatment is Tamoxafen, which is the tablets that I take, and that's 10 years worth. So basically, Tamoxafen it doesn't. It attaches to the hormone receptors in cancer cells, blocking estrogen from attaching to the receptors. So basically, it stops the cancer cells getting to the hormones that feed it. So it's stopping the estrogen getting to the cancer, is what I'm going on about. Again, it's all estrogen led with me. So we're just suppressing all of that, and we're just trying to not let me produce that, really, which in itself, not producing any estrogen and being only mid-30s, it does cause havoc on your bones, and it is causing havoc on my bones, and it is extremely painful. But the side effects of Tamoxafen is bone pain, hot flushes, nausea, fatigue, mood swings, depression, headache, hair thinning, constipation, dry skin, and loss of libido. Yeah, so it's a lot of things for your body to go through, and there's a lot of side effects. Now, you might not get hardly any of these, you might get all of these, and it can change. So some of the side effects that I'm getting now, I never had in the beginning. Some of the ones I had in the beginning, I don't have now. I don't know whether your body kind of gets used to that. I don't know. But I am extremely grateful for all the treatment that I've had and that I am having. So I kind of look at it as any side effect that I'm getting, I know it's working, and I know that it is dealing with it. So when I get my hot flushes, when I feel sick, when I get my headache, insomnia is crazy. I suffer really bad with that. But to me, I'm just like, the drugs are working. The drugs are doing what they're supposed to do, please, and let them continue working. But yeah, so that is basically the treatment that I'm on, and that was my 10-year plan. I will do a video on cold capping in hair, because I have had a lot of questions about that. I will definitely do a video on that soon. But please follow me on Instagram, because that's where all my pictures are. That's where I put more things that I'm actually going through. And I'm actually having my 3rd round of Zoladex acid tomorrow. So I'm back on the chemo ward tomorrow for that, to try and strengthen my bones and prevent bone cancer and osteoporosis and stuff like that. So I will be putting all of that on my Instagram tomorrow. But yeah, as same as before, any questions, anything like that, please get in touch, because I'm always more happy to help. Thank you.